Today, Premier Ford said he'll have a sit-down with the province's top doctor about moving into step 2 of the pre-opening a little earlier than scheduled. But the chief medical officer is pumping the brakes on the possibility. Jason Gaidola joins us live with more. Jason.
Taz, Dr. David Williams says while Ontario is meeting its vaccination targets, cases aren't low enough and the Delta variant is continuously emerging in many communities. Two of Ontario's reopening plan is currently slated for July 2nd, but with recent COVID-19 trends heading downward, Premier Doug Ford says he'll look into an earlier start date.
We will be sitting down with the health table and the science table. I'll be talking to Dr. Williams. I just want to tell the people of Ontario, there's no one wants to open this economy more than I do.
Nearly 20% of adults in Ontario are fully vaccinated, a key target to reopen the next phase. But Dr. David Williams says other metrics aren't good enough just yet.
The Premier probably will ask me in that, and I would say here's our numbers, just like I've said today. These are numbers that are better than they were. They're still high, and we're still got a ways to come down.
Williams says he wants to wait 2 more weeks after hitting the 20% vaccination mark and see a quicker declining rate in case counts, ICU admissions, and the spread of the Delta variant.
We do not want that. We don't want to even give the 4th wave a chance to get a foothold. And I know the Premier definitely doesn't want that. The Minister Elliott, does not want that. No one really wants that.
Under step 2, people can have more gatherings, retailers can increase capacity, and personal care services like barbers and salons can restart operations. Ford was asked if some low-risk businesses like personal care could reopen earlier and potentially outdoors, and he says that will also be a part of the discussion.
I don't want to put any dates on it. I do have to sit down with Dr. Williams and the health table. I know discussions are going on right now.
So it's a thought in there, but we have to serve the whole wide sector. And there's not just those. If we're doing personal care settings, there's a large number that would say if they can, why can't we?
We saw Ontario begin phase 1 a few days earlier than scheduled, and Dr. David Williams says there is a possibility that phase 2 could begin a day or 2 earlier, just in time for Canada Day. But he says that decision will be based on the data in the coming weeks, and it likely won't come until we get closer to the holiday.